disease. I want all of us to pay attention to today's class. Why? Because too many Nigerians are really going through this problem, and many more Nigerians might join the queue of people with nephropathy. That's another term we use for kidney disease. Nephropathy is a technical term that most medical personnel prefer using when they are referring to kidney disease. And what it means in essence is a damage or inflammation of your kidney. If you look at the diagram that we have in front of us, you are going to see how a healthy kidney looks like and how a diseased kidney looks like. There is nobody who will see this and will want to pray for even his or her enemies to have a diseased kidney. The sight is always very gory, and we will not wish even our enemies, let alone ourselves, to come down with this kind of condition. So once you have inflammation to your kidney and your kidneys begins to malfunction, you're said to have a kidney disease. But let's dive further into this phenomenon or this condition. There are several types of kidney diseases, and these different types are dependent on the disease-causing agent that can trigger inflammations or that can lead to your kidneys being diseased. Now, let's look at one, diabetic nephropathy. Diabetic nephropathy, just as the name suggests, is associated with a kidney disease of a patient that has diabetes or suffering from diabetes. So what this tells you in essence is that for patients with diabetes, they stand the risk of having a kidney disease. And once their kidney begins to inflame and they are diabetic, such kidney disease could or be linked with the diabetes, where the term is changed to diabetic nephropathy. Then we equally have another type of nephropathy that we refer to as IgA. And this particular type is purely antibody buildup within the kidneys. Once we have antibody buildup that begins to make the kidney malfunction, then once a diagnosis is done and the antibody test is done and is linked to the kidney problem, then such a person is said to have an IgA nephropathy. Then we equally have another type of kidney disease that is caused by a lupus, the presence of lupus or a lupus condition. It's purely an immunological condition. It's purely immunological. Lupus is purely immunological, and once situation is the kidneys are linked to these immunological challenges, then we said the lupus, the nephropathy is lupus linked. Then we have others. There are other types of nephropathy that are either hereditary, especially Alport syndrome. And so we refer to this one too as being a genetic condition that the person might pick up. So by and large, there are different types of nephropathy depending on the conditions that trigger the kidney problem in the first place. Now, for chronic kidney disease is a long-term infection. That means your kidney may have started gradually, as we will later see in the body of today's presentation. Your kidney may have started malfunctioning gradually until it gets to a point where it no longer is able to perform. So that's why we refer to chronic kidney disease as a long-term kidney disease, a long-term kidney infection. That is, your kidney have had abnormal kidney function, or the structure of your kidney has become abnormally changed. There's an abnormal change of structure to your kidneys. So once the function has been impaired, once the structure of your kidney has been impaired, then both combined, we refer to it as a chronic kidney disease. Why? Because the function is no longer there and the structure has changed to depict the malfunctioning of the kidney. So to summarize, we have kidney problems arising from certain health conditions that the patient might be going through. That is why we always preach that we must watch how we go about our health life in order for it not to trigger multiple problems for us. Now, kidney disease can affect your body's ability to clean your blood, because later we're going to see the various functions of the kidney. So once you have a kidney disease, it can affect your body's ability to clean your blood and filter some of the filter out some of the impure aspects of your blood. That's things that can really make your blood not pure. Apart from that, once you have a malfunctioned kidney, it makes it extremely difficult for production, and as well as vitamin D metabolism. And you know, for vitamin D metabolism, we need it for bone health. Now, when you look at an average individual has two kidneys. A normal human being has two kidneys. And these kidneys are located side by side of your spine, just above your waist. So once these kidneys are damaged, you find out that there's going to be fluid buildup within your body. And that is why in some patients, once there's this fluid buildup, you find them having swollen ankles. Some of them experience weakness. Some find it very difficult to sleep. Some have shortness of breath. Some have, you see, the feeling of vomiting, and it varies from individual to individual. So we are going to see more as we move along. Now let's look at some of the functions of our kidney. Functions of our kidneys. Number one, a healthy kidney should be able to balance water and minerals in your body. A healthy kidney should be able to balance. That means it helps with balancing of water and minerals in your body, such as sodium, potassium, phosphorus. And they do this in your blood. They balance this water and minerals, that is sodium, potassium, phosphorus, in your blood. They are equally responsible for the removal of waste from your blood after digestion. So after you must have taken your meal and you're fully rested, they go out to look for some of those waste products that you may have taken in. And once they see it, they do their best to get them out of your body. They equally help us with our muscle activities and assist us whenever we are exposed to chemicals from medications. A lot of us taking medications with lots of chemicals. A lot of us taking so many items that the chemicals are injurious to our body, so they take them out. Now, your kidneys are equally responsible for production of renin. They are equally responsible for the production of renin, and your body uses it to help manage your blood pressure. So you can see the extent to which your kidneys are linked to either you having a high blood pressure, a normal blood pressure, or a low blood pressure. So They are responsible for making renin, and renin is needed by your body to help you manage blood pressure. Now, apart from that, too, they equally produce a chemical component known as erythropoietin. And this particular erythropoietin helps or prompts your body to make more red blood cells. In the event that you have low red blood cells, you can imagine your kidneys, making chemical substances like these ones that will now help prompt the production of red blood cells. Now, outside this, your kidneys are equally active. They make active form of the vitamin D, the active form of vitamin D. And this vitamin D, your body needs it for bone health, as well as other bodily functions. Then don't forget, please, if you forget everything that I've said so far, please don't forget this one. Every 30 minutes, your kidneys filter all the blood in your body. Every 30 minutes, your kidneys filters all the blood in your body. You can see how beautiful the kidney is, especially to our health, to we being healthy or staying healthy. So there's no need for us to do anything that will injure our kidney. You can see their functions, they are numerous. Now, for those that have kidney issues, some of the signs you will see, or some of the signs that the patient will see includes the following: extreme tiredness, that's fatigue. In some patients, some experience this feeling of vomiting, some actually outrightly go out vomiting. Another noticeable sign is swelling, where what medically we refer to as edema, particularly around your hands and your ankles. For those who are watching my screen, you can see the diagram clearly, visible before you. In some patients, they experience or complain of confusion or trouble concentrating, while in some patients, we see them experiencing poor appetite to food. And even when they try to eat the food, they feel as if something metallic is on their tongue. They have this case of feeling metals around their taste buds. And that's another noticeable sign. Some have cramps, that is a muscle spasm. Then in some patients, you find them going out to pee more often, while in some patients, they have dry or itchy skin. So we see in some patients too, there's a combination of all of this put together, not just one single sign. Some have combination of 2-3 signs put together. Now, let's look at the global prevalence of kidney disease. Over 850 million people, which represents about 10% of our global population, have this problem. So you can imagine if you look at the entire global population of humans, and you now have 10% of this total global population suffering from kidney disease, it shows clearly that we are battling with a new wave of a disease condition. And as research has equally shown that it is not even going down, it is not abating at all. Rather, it is climbing up, it is soaring higher and higher as the days and the months go by. So kidney disease, more and more people are beginning to come down with this problem. And the reason for this lecture that Superlife is bringing to us week in, week out is to really, draw our attention to some of this global problem so that we do not form or become part of it. And that is why we do this. Why we're enjoying doing this is because we are helping lives. And as a company, Superlife is going all out to see how we can bring more to live a healthy life, and a very happy life.
Where are the accent are they come?
Now, look at the map before you. You can see some of the very strong areas where the disease prevalence tends to be high. For some of you who are that are good in geography, you can pinpoint where the map of Nigeria is. And if you look at the color there, you can see that Nigeria forms is part of the lower middle countries with the rate of kidney disease coming up, while you have countries like the United States, Canada, and Greenland, Russia, and half of Europe having very high prevalence. And notwithstanding, if you look downwards, you're going to see the map of Australia there is entirely in blue. So you can tell that most of these countries, there's really high rate of kidney disease. Usually the prevalence was initially low back in the days of our forefathers. But as we begin to imbibe Western cultures, we are beginning to come down with their own kind of disease. Now, let's look at the Nigerian situation. We have observed from research that hypertension, diabetes, and obesity are the precursor or the triggers to some of the kidney problems we see in Nigeria. High blood pressure, diabetes, obesity. And the good thing about these three is that in our lectures here that we've done during the past months, we've taken time to give lectures on high blood pressure, and we spoke extensively on hypertension under high blood pressure. That's another name for hypertension, high blood pressure. Then we equally looked at diabetes. We've looked at diabetes in our class, and we've equally looked at obesity. So for those, for some of you that have missed these three lectures, I will kindly advise that you go back to our previous lectures and you look at these three: high blood pressure, diabetes, and obesity. So these are the three triggers to kidney failure in Nigeria from research. Please, I'm insisting from research. So the data we currently have is that kidney disease is gradually going up. And we can tell why it is going up. We are beginning to have more people with high blood pressure. We are beginning to have more people with diabetes in Nigeria. The issue of obesity is still there, it's still a burden, it's still a problem in Nigeria. So the scientists that have done this work, they are quite apt in their conclusion. Now, let's look at the 5 stages of this problem. Let's look at the 5 stages. But before we go to the 5 stages, let's discuss on something that we do in the lab. Something we do in the lab. For us to understand the stages of a kidney problem, there's a test that we do, we conduct, we call it the estimated glomerular filtration rate. We check for it, it's a blood test. We call it EGFR, the estimated glomerular filtration rate. We check for it. And the EGFR for your kidney, for a normal kidney, ranges from 90 to 120. It ranges from 90 to 120. It's purely a clinical chemistry job that we do in the lab. So once you walk to a recognized medical diagnostic facility and you tell them you want to know your EGFR, please, they will conduct that test and give you your value. I don't want to go into the nitty-gritty of it because it will take more time. Now, once we conduct this test and your result comes out, your result can determine the stage of your kidney. The result can determine the stage of your kidney. So for all of you listening to me right now, you now know the normal rate. Though it may vary from countries to countries, it may vary from just slightly. The variance might just be slight. But once your result comes out and your result, your GFR, falls between 80 to 89, don't forget, I said the number range is 90 to 120. So once your result comes out and your GFR is 80 to 89, at this stage, your kidneys have mild damage but still functioning normally. Your kidney does what? It has mild damage, but it is still functioning normally. Please, let's pay attention to what I'm saying now. Now, once you carry out your test again, and your GFR falls between 60 to 79, you have more damage to your kidneys than in stage 1, though your kidneys are still functioning normally. I'll take that again. Stage 2 of the kidney disease, stage 2, is you have a GFR of 60 to 79. That means your GFR falls within the range of 60 to 79. So once your GFR falls within this range, we know that you have just gone beyond stage 1. Your kidney problem is stage 2. We are looking at stage 2 kidney problem or kidney disease. In stage 2, your kidneys will still be working functionally well, but there's a problem. Now, stage 3, once your result comes out, and we notice that your result falls within the range of 30 to 59, then we now know that we are looking at stage 3 kidney disease. Stage 3 kidney disease. Please, at this point, I want to know if I'm being followed or whether I'm the one following people. Please let me know. Hope I'm being followed.
Doc, we are following you. Doc, we are following you, please.
It's okay. Thank you very much. So once your test is done, once you go, tell them you want to know your GFR and your result comes out, please just look at your result and look at this lecture that we are giving out to you today. If your GFR is within the range of 30 to 59, then that kidney problem is stage 3. In stage 3, you may have mild or severe loss of kidney function. At stage 3, you may have mild or severe loss of kidney function. Now, once you collect your result and your result falls, your GFR is between 15 to 29, then we are looking at stage 4 kidney disease. So at this point, you have severe loss of kidney function. You will experience severe loss of kidney function. Now, again, if you collect your result and they tell you your result, your GFR is below 15, then my brother, my sister, this is no good news. It is no good news. Your kidney are nearing or is experiencing complete failure. Complete failure. At this stage, nobody will tell you that something is wrong. Even you as a patient will know something is wrong. A lot of patients that go for dialysis, most times their results have a GFR of below 15. So from this class, all of you have now seen the easy way of identifying or knowing the current state of your kidneys. The current state of your kidneys. Let's go further. What are the first warning signs of kidney failure? What are the first warning signs of kidney failure? Now, it will interest all of you to know that there are some people that may have started having stage 1, stage 2, even up to stage 3 kidney disease without even experiencing a single sign or symptom. Yes, you can your kidneys might be degenerating, yet there might be no physical signs or symptoms to let you know or warn you in advance. So that is why it is always good as for somebody who loves his or her health to always walk into a lab, a recognized lab, to find out, please, I want to know the state of my kidneys. Now, other signs that you will see later, one includes extreme tiredness, that is fatigue. Though I've mentioned it, but let's re-emphasize them over and over again. The feeling of vomiting, while some go outrightly vomiting. There's confusion. Some people experience this confusion, lack of concentration. Then the swelling of the legs, cramps, muscle cramps, that's muscle spasms, itchy skin, loss of appetite, and so many others like that. Now, the next question we're going to ask is, what are the most common causes of kidney failures? By now, all of you should know, because when we started the opening, the names of the kidney problems were linked to diseases that we already know. So, 1, diabetes. 2, high blood pressure. And once you have high blood pressure, it means your blood is passing through the blood vessels more forcefully. And once you begin to have this forceful movement of blood around your blood vessels, you now find it affecting or damaging the kidneys as well, because you find, if you look at that initial diagram I presented at the start of this lecture, you're going to see how blood vessels are connected to your kidneys. So once you begin to have a patient with high blood pressure, having blood passing through the blood vessels forcefully, no, it's not good. It's not good for your kidneys at all. They don't like it. They want the blood to flow normally. Then other conditions that we have seen that can really lead to a kidney problem is what we refer to as polycystic kidney disease, a condition you inherit from your parents. So inheritance is one. Inheritance is one. Then another condition that we see that can lead to kidney disease is what we refer to as glomerular disease, when your kidneys begins to find it extremely difficult to filter waste. So another one that we mentioned at the start of this class was lupus. I told you it was purely an immune problem. So lupus is an autoimmune disease condition. And in my class, I've always informed you, anytime you hear the word autoimmune, it means your body from nowhere, the cells of your body begins to attack other cells for reasons that are usually not clear. We see these conditions medically in so many patients. And that is why the Super Life products come in handy. Why? Because since they are all purely plant stem cell based, you find out that, and they act at the cellular level. So, taking of Super Life, the reason why scientists, medical personnel, researchers love Super Life products is because at the cellular levels, it prevents immune diseases from occurring in the first place. So you can see how beautiful it is. And let's go further and look at some other conditions that you may see when somebody is experiencing kidney disease. Some other conditions that can trigger it, like people that engage in self-medications, where you take drugs that are not properly prescribed. Such drugs can affect your kidneys, especially if the chemicals that are inherent in these drugs are so heavy that your body cannot handle. You now find yourself really giving your kidneys a serious problem. Then, not to talk about severe dehydration. That's why we advise that you take in water a lot. We're taking water a lot. We've equally seen urinary tract obstruction that can equally lead to kidney disease, because once you cannot pass urine properly and you begin to have this, your bladder filling up to a point that you're not passing out urine early, it can affect your kidneys. That's why once your bladder is full minimally, please try and discharge the urine content. Do not allow your bladder to be so bloated with urine before you go out to urinate. And we've equally seen some heart diseases and liver disease condition that can as well affect your kidneys. Now, what are the risk factors for kidney failure? One, diabetes, we've mentioned it, high blood pressure, heart disease. Then once you are over 60, please, from 50 and above, but basically medically we say from once you are 60 or and above, please, you really need to constantly check with your medical personnel. Though the whites say we blacks are more prone, is because in the past we were not, but now we are becoming more prone to this Western disease. We are becoming more prone now. The upsurge amongst black is getting higher. While the whites are doing their best to reduce it, we have taken up that challenge of beginning to develop kidney problems. And in time past, just like I had emphasized at the beginning, or when we're looking at the statistics from Nigeria and the global statistics, I said that in time past, the issue of kidney failure was very extremely low. It is now we're beginning to see an upsurge. Then please, I want to read part. Hello, can you hear me? Hello?
I hear you, sir. We can hear you.
Please, I want to reiterate this fact. Stop getting drugs that are not prescribed by medical experts. Don't go to any quack or any roadside seller and you buy drugs, especially painkillers. These painkillers can end up affecting your kidneys dangerously. Most times you buy drugs, you don't read the leaflets inside, you just keep on taking them non-stop. I know of a woman that will never take paracetamol 2 tablets. To her, taking 4 tablets at once is the only solution to her pain, in relieving her body pains. So you can imagine somebody who takes 4 tablets in the morning and take 4 tablets in the night, what such a person is doing to her kidneys. So please, we want to advise, don't just pick any drug and you begin to swallow. Get medical advice. What are the complications of chronic kidney disease? What are the complications? Number one, low red blood cell count. The patient is going to be anemic. Why? Because the production of red blood cells have gone down. Remember when we're looking at the functions of the kidney and how it relates to red blood cell production. So once you have a kidney disease, there is going to be a low red blood cell count. So the patient becomes anemic. The bones of the becomes weak and brittle. Don't forget, we talked about vitamin D and how it helps with bone health. So the absence of vitamin D begins to affect the patient's bones. So the bones becomes weak and the bones looks brittle. You remember in one of my classes on arthritis, we talked about gut. We talked about gut. For those who have forgotten, please go back to that class and look at my lecture on arthritis. You are even going to see the diagram there, gut, G-O-U-T. So you stand the risk of developing gut. Then the patient will stand the risk of having metabolic acidosis, that is chemical imbalance, which is purely acid-based in your blood. So once there is this chemical imbalance, which is purely acid-based in your blood, it has a lot to decrease your kidney function. We've talked so much about high blood pressure, that's hypertension. So there's no need for us to speak further on that. We've talked about heart disease, that can increase your chances of having stroke or heart attack. And once you have this high risk tendency of developing heart attack or stroke, know that one way or the other, it's already affecting your kidneys. Once you have nerve damage, you stand a risk. Once you have high potassium in your blood, the one we refer to as hyperkalemia, you stand a risk of developing a kidney problem. And once you have high phosphorus, you have another risk again. High phosphorus, medically we refer to it as hyperphosphatemia. So once you have hyperphosphatemia, it's another challenge. Now, once your immune system is weak, it's another challenge. So you now find yourself having all of those signs and symptoms coming on you as a result of these problems. So that is why it is advised that you go do a blood check, a clinical chemistry check on your blood, so that you'll be in a position to now know how best to handle your situation. Because in today's class, on your own, with the figures written down on paper in your hands, don't even tell the medical lab scientist. Once your result comes out, use your hand, open your palm, look at the range from here, look at the range they are giving to you. Do not ask yourself, hey, is it stage 2, stage 3, stage 4, or it's normal. My prayer for you today is that by the time you go check, your result will be normal. That is my prayer. Because for those who have been listening to us week in, week out, we know very well that you've been taking our advice and you've been doing your best to stay healthy. So for all of you here, I know definitely for sure that once you go check out do your test on your kidneys, you will definitely get a good result. Your GFR will be good. At this point, please permit me to invite the one and only, my Farm Chilaka, to continue today's lecture to discuss further on diagnosis and tests, while our able coach, Coach Samson, will be coming on to discuss on our super life for kidney disease.
Doc, we have Dr. Chuks.
Whoa.
We are privileged to have him.
Wow. Yes. Let me announce our one and Dr. Chuks. Dr. Chuks, you are welcome. In fact, I'm happy to have you around today, especially on the day that we are discussing kidney disease. Please, go ahead. You can take over.
Yeah, you just bring up the super life stuff. So the solution. Can you
okay, good evening.
share the slide? Okay, Doc, you're welcome.
Good evening, Dr. Rolf. Good evening, sir.
Good evening.
Good evening, Doctor.
Yeah, good evening. Thank you very much. Good evening, every member of the House. I can see you have done very, very elaborate job in the discussion of chronic kidney disease. Yes, the truth of the matter is, as you said, because of the asymptomatic nature of stages 1 and 2, mostly like up to stage 3, many people are unaware of the damages kidney malfunction can cause. Even at that stages 1, 2, 3, there are mild damages, mild malfunction. But because it is asymptomatic, we cannot really know the excess. So, but with the use of Super Life products, some of these asymptomatic disease or asymptomatic problem, we have them in our system, but we are not seeing any visible signs and symptoms. That's why we are saying they are asymptomatic. The use of Super Life product will help in dealing with them. So when you take Super Life, especially the stem cell and the Super Life Immune Care, because every problem is, has to do with your immune system. Where cells are affected, where tissues are affected, there must be compromise in the immune environment of that cell or of that tissue or of that organ before the cells, the tissues, or the organs begin to pack up. So the use of stem cell and SIC, Super Life Immune Care, helps to, galvanize a perfect immune system, galvanize a perfect immune network, and build resistance. So once you have perfect resistance through your able soldiers in the body, which are basically your white blood cells, so the person will be able to overcome those immune challenges that predispose them to diseases. So that is the advocate for prophylactic use of Super Life products. Prophylactic use means you use them without any disease condition. Use them because of asymptomatic disease condition, that you have some disease condition, but you don't know because there's no visible symptom. Use Super Life product, and you use them for future to prevent future occurrences. So that is what it does for us. So you will see, if somebody is experiencing, just as Dr. Roof said, you have not gone for what we call kidney function test, especially your electrolyte, your urea, and the creatinine, you will not be able to know the level of the functionality of your kidney. So if you don't do that, and the stage that the kidney disease is not visibly manifested physically, it is going to be dangerous. But while you do all this screening from your electrolyte and urea and your creatinine, and they eventually do your creatinine clearance, when they do your creatinine clearance, they will be able to calculate your estimated glomerular filtration rate, that's EGFR. So when they're able to calculate that from the tests that they do, when they calculate that, they're able to know exactly where your kidney function lies by reason of the glomerular filtration rate. Are you getting it? So but by and large, our Super Life products, like the stem cell and the SIC, they are able to, build a perfect kidney function for you. Now, in managing this chronic kidney disease, especially let's talk about between stage 1 to 3, where you have mild effects, we recommend STC30 and SIC. Now, what do they do? The kidney, the function of kidney is filtering the blood, taking away the waste, absorbing the nutrient, absorbing the good minerals, and filtering the waste and expelling them through the urine. So that is the job of the kidney. So, and that job is done at the glomerulus. So, and in the glomerulus, you have network of capillaries. You have network of capillaries, and you have, nephrons, which are the functional unit of the kidney. So you have a lot of them in the glomerulus. Now, and you have some cells that are called, you have podocyte cells, you have mesangial cells, you have glomerular endothelial cells, and you also have, tubular epithelial cells, all in the kidney. So once these cells are defective, once these cells are problematic, the ability for the kidney to filter blood will be defective. So what Super Life product does, it enhances this function of these messenger cells, podocyte cells. It enhances the function of tubular epidermal cells and the endothelial cells. So when these cells are dead, by reason of stem cells, you try to build new ones. When these cells are, compromised, it try to, invigorate them. When they are weak, try to strengthen them. When they are sick, try to restore them back. And when they are active, try to make them, replicate themselves in their activity. So that is what the superlight product does. Then also things like calculi, that is stones, when by reason of maybe other disease condition or other challenges, stones are precipitated in the kidney tubules. And when stones are precipitated in the kidney tubules, the kidney is not able to perform its function. We call that one renal calculi or kidney stone. And when you have that, or what you call nephrolithiasis, when you start having kidney stone. So when you have this problem, when you take ST30, for example, and combination with SIC, the ST30 has what we call citric acid by reason of grape stem cell, the solar vitis that is in ST30. The grape in ST30 is a stem cell. So which scientifically composed stem cell. Now that citric acid reacts with calcium. So as you take it, it goes to look, because the precipitation of stone is in the form of calcium. So now what the citric acid, it reacts with calcium to form calcium oxalate. So when it forms calcium oxalate is easily excreted through the urine. So in that nephrolithiasis or the renal calculi or the kidney stone. That was so our ST30, don't remember, I'm trying to tell you some of the functional mechanism or how it deals with kidney challenges. So somebody having kidney stone, when we give ST30 alongside with SIC, the component of the ST30, there are a lot of citric acid there. So, of course, citric acid are organic acid, which are capable of taking away solid substances, which are in the form of calcium. So it reacts with calcium now and clears them away, convert that calcium to calcium oxalate, which is soluble, and, it goes out of the system. You see, so that is how it deals with that kidney stone. So then what our product also does, apart from, energizing or rebuilding cells, is there's what we call kidney renal parenchyma. There's what we call renal parenchyma. Renal parenchyma are tissues of the kidney, are tissues of the kidney which help the kidney to perform its function. So that's why you see sometimes, like what Dr. Rose mentioned, he mentioned a cyst. Mention cyst. Sometimes when you see cyst developing in the cells, of course, the parenchyma cells come together to form the parenchyma tissues, which we call the renal parenchyma. So when they are diseased, it will pass on the function of the kidney. So what our product does is that it, enhances the function of renal parenchyma. So when the renal parenchyma cells are intact, the kidney function is also excellent. It makes the kidney function to be exact. Now, also, what our product does also, this issue of homeostasis. Homeostasis is a role played by the kidney. The kidney helps in balancing electrolytes and water because it does absorption of electrolyte, absorption of water, and also excrete the waste. Are you getting it? So what our product does, it enhances, distal tubular function. The kidney has what we call loop of Henle. In that glomerulus, we have what we call loop of Henle. So the loop of Henle is the part of the kidney tubule that is the U-shaped part of it. Now, there is the first part of it called the proximal tubule, which is the descending part of the kidney tubule, which goes through the loop of Henle, then it goes to the ascending part. That ascending part is what we call the distal tubules of the kidney. Now, at that distal end, that is where you have reabsorption of specific important minerals. So most time this kidney chronic kidney disease greatly impact on the distal part of the kidney, impact on the distal tubular function. So it affects reabsorption at that time, and it also affects secretion. So what SuperLife product does, it enhances tubular function. So there will be perfect reabsorption where the kidney need to take in important minerals. It will enhance it to take in important minerals and facilitate the kidney to also excrete waste. As it takes in the important minerals, it will excrete what? Waste into the urine. Impacts also on the kidney. If the kidney is not functioning, the waste will be accumulated. So as the kidney is not functioning and accumulating waste, your SuperLife product or SIC, it will help that tubular function. That is, it increases tubular reabsorption of important materials and tubular secretion of waste material. In other words, it will help remove every accumulation of toxic substances out of the system. So now, even at stage 4 to stage 5, where you now have what we call ESK, that is end-stage kidney disease, ESKD, that is end-stage kidney, where, for what Dr. Rod was saying, where the kidney is completely packed up, we say, total kidney failure, then the person needs either a kidney transplant or dialysis to be able to perform tubular excretion or glomerular function work. The SuperLife product has also resuscitated somebody that was admitted in a UNTH, that's University of Nigerian Teaching Hospital. This person was at stage 5. The glomerular filtration rate was, let's say, was at 15. It was at 15. So the person was completely, out of life. They were conducting dialysis for him. I think it was 3 times a week, which to tell you how damaged that kidney was. So when we gave SuperLife product ST30 and SIC specifically, the ST30 was twice, the SIC was also twice. He was in the hospital. They were giving him without the knowledge of the nurses and the doctors. So after like 2 weeks, they now asked for examination. After examination, clinical examination, they said it's like there's improvement. The glomerular filtration rate went to about 40-something. So they have to increase the days of dialysis. So the dialysis now, instead of 3 times a week, they were now putting it once a week. Then the following 2 weeks that made it 1 month, the dialysis became, twice. That it became every 2 weeks. So that was how we managed this person for at least 3 months. Then he was discharged from the hospital. Was becoming stronger and better. No more vomiting, no more itchy skin, no more urine. He was doing very well. So you see that. So, but the doctors were surprised. How come? Because people that were praying were coming there to pray. People come to the hospital to pray. They just felt that magic. It was God intervention. Though it was God intervention, because we don't rule out God from anything. But it was that product that they were giving that patient that resulted in they have to, discharge him from the hospital. So we have our SuperLife product has materials as nutraceuticals. Nutraceuticals are important, plant-based materials that are of high, therapeutic value. We have them in ST30. We also have them in SIC. So why we talk about this SIC? Because of the immune. When Dr. Rose mentioned about immune challenge. Immune challenge is really from systemic point of view, where you have autoimmune challenges. So, but with the use of SIC, we're able to deal with autoimmune challenges that is, that accompanies kidney dysfunction, because that challenge should have come before the kidney start packing up. So our SIC, we have the guarana extract, we have the spirulina extract, we have the wildlife alpha. We have the alpha, that is Aphanizomenum species. It's a form of wildlife species of plant that has a lot of polysaccharides and polyphenylethylamine. I know that these two compounds, polysaccharides and polyphenylethylamine, are immune boosters. They guarantee perfect immune function and perfect well-being of the individual. And we have about 18 amino acids in that Aphanizomenum species that is in SIC. And you know the role of amino acid in kidney function. So when the amino acid helps to keep the kidney, the DNA of the kidney cells intact. So when the DNA is intact, so there is no possibility of having a misinformation. So when there's no misinformation, the kidney function very well. Well, of course, DNA codes instruction of how a particular organ or cell or tissue will function. So if the DNA is abnormal, there will be misinformation, and you see it physically that the thing will be manifesting dysfunction. So that is what we have there. Then there is also what we call the snow algae. The snow algae is a cryophylic plant, that is cold-loving plant, that has a very important we call it polyphenol, or we call it antioxidant, that what do you call it, the snow algae. So it has very power-packed antioxidant that also guarantee perfect kidney function. So you can see, so the challenges of chronic kidney disease is not thing to be afraid of. In this new edition of the manual that is coming, you see, if you look at the manual now, like what we have in the manual currently, we recommended SIC and ST30 to be taken twice daily between 12 to 36 weeks for severe cases. Then we can also take it once daily for mild cases, like between stage 1 to 3. You can take it once daily. Take SIC once daily, ST30 once daily. But for stage 4, stage 5, we recommend twice daily. So in the new manual that is coming, in the new edition, we stage it. We categorize it now to stage 1, stage 2, stage 3. We stage it. Then we also included glomerular filtration figures. That when your glomerular filtration rate falls below 90, it's already tending abnormal, because normal is from 90 and above. So we gave the range of glomerular filtration figures, like what Dr. Rich was talking about, to denote the progression of the kidney damage or of the kidney disease. So in this new book that is coming up, there are a lot of introductions. There are a lot of inputs that we have made. That when you see it, you'll be very, very much happy with it, because there are a lot of new findings from research that we have added the knowledge in putting up the new edition of the manual itself, especially this kidney disease area, up to end-stage kidney disease. Even the clinical investigations, laboratory investigations, we also dealt with. Even that autoimmune involvement, we also dealt with, and how Superlife product was used to manage it, including the Superlife Terra hairs. How we also incorporated it in the management of kidney dysfunction or chronic kidney disease. So it's going to be very wonderful. Well, I think by the grace of God, before the end of October, the write-up will be completed, and we will now present to directors, and eventually they present it to the company, where you will now have a wonderful book in your hand that Anywhere you are, wherever you are, once you study that book, you can stand anywhere, and with all the knowledges Dr. Rove has been giving people on series of diseases, because I've seen that he has been taking people on series of diseases. Yes, it's not an academic class, but it's when you know about a disease, you are very confident to be able to talk about super life products that can deal with it. Of course, they are your manual, and you have knowledge about it. So not that somebody will be confusing you or you have not heard about it. So since he started taking people, I've seen that he has taken several disease conditions. And those several disease conditions he has taken, you have had knowledge of them, even if you cannot completely say them the way he's saying it, but you have knowledge of them. And the knowledge of them will help you use your super life background to deal with them, to prescribe the dose, to prescribe the administration, to prescribe the duration, and to prescribe the follow-up, judging from the manual. So that is it. So we are hopeful. We are very glad that our product can deal with SIC and ST30 can deal with that. Then if when you have things like renal cancer, there are sometimes rare conditions we have renal cancer. At that time, we include SNC. We add SNC to ST30 and SIC. And at that time, the three products are used. ST30 twice, SIC twice, and SNC once. So to deal with that. Even there are some cases of kidney stone that are severe. We can also add SNC to it, because SNC, we have found from research that ginkgo biloba has a lot of good benefit on the kidney function. Yes, that's what we found that. So that is it. Then, of course, things that make kidney function difficult, like pyelonephritis, that's bacterial infection of the kidney. Pyelonephritis, so when this infection has stayed long, it tends to impact on the kidney function. So because our products, supply products, SIC and S30, they are antibacterial, they are antiviral, and they are parasitic. So they help to deal with that, so they can flush out pyelonephritis within 3 months, take it away. So even the formation of cysts, it take it away, it dissolves cysts. So that is it. So we are very glad that Super Life product S30 and SIC can deal with this kidney disease. So I think we'll stop here, and so that we'll give room for questions. Thank you very much.
Thank you. Thank you. The doc himself.
Thank you so much, Doctor.
This the mechanism of action of our products is just. Thank you for the report. Please, this is the time for question and answers. If you have any question, go to the chat room. The doctors are available. Even I think I cited Pam, but it's like the network is taking him out again. So please go to the chat room and drop your question, so that we are going to read it for doctor to respond to those questions. This is a practical, that's why we call it a workshop. You could see it's a really, really well robust workshop. Even the updates that is on top of it, the updates. So while you are dropping your question, is practical action on today's topic. Possibly, let's just make it on today's topic. It's so elaborate. Whether you have somebody thereabouts, of course, our doctors are even available for personal conference call. Maybe there are peculiar cases you want to also have a personal conference call. Please just let us know so that we can secure the appointment for that. irrespective of wherever you are, whether within Nigeria or outside Nigeria. Is a free consultation. Of course, you know, if you go and meet him in his office, you know what it means, how much for you to secure a card. But because of Superlife, he has volunteered a whole lot. Both Dr. Chooks, both Dr. Eme, Fan Chilaka, and many others. So the consultation is free, courtesy of Superlife. So then, please, I want to use this opportunity to invite us on tomorrow workshop. That side is on a business. Is on a wet creation. Tomorrow, 8 p.m. Nigerian time. We'll have a series of the principles of wet creation. We have started since last week. So I think we'll be wrapping it up by tomorrow, Saturday, 8 p.m. Nigerian time. Please, it's good you come. It has been the principle that has produced multi-billionaires in dollars for over 100 years. And that principle is still valid till today. So please, it's very important that we have that solid foundation that we can build our wealth, not back and forth. You made it today, tomorrow you slip out of your hand. No. This principle has been tested and proven. So see you tomorrow, 8 p.m. Nigerian time. I promise you. You will be happy that you are in that meeting. So I don't know. Samson, Coach Samson, I hope you are there. So check the chat room. There are questions that are there already. Is Samson there?
Something is echoing. Your mic is echoing. Your mic is echoing.
My own mic?
Yes.
Okay, let me mute it while you continue. Sorry.
Maybe the second phone is on as well. So this one says, when a patient is on dialysis, how can we administer our product? And secondly, our product we have to consume with a lot of water. What is your advice?
I gave instance just now. Somebody that was in the University of Nigerian Teaching Hospital. The person was on dialysis. You see, administer it twice. ST30 twice, morning and night. SIC twice. SIC you can give between the hours of 9 a.m. and 6 p.m. It's also twice. Then you don't consume much water. It's little, very minimum water. You don't consume water when you are
prescribed. The little water they are
when you are dealing with kidney diseases. Then you must avoid proteinous things like milk, meat. You avoid them when you are treating kidney problem. Avoid meat, milk, proteins. You reduce them to the barest minimum. Yes. So that's how you administer it. It's also twice. So is the person okay?
No, about cancer. He said, what do you recommend about cancer? What type of cancer? The person that is asking this question to cancer is not it's a general name. So what type of cancer? Then he said, can we get the book on the French version? That would be another work entirely.
I didn't hear you.
No, somebody was saying that can we get the book on French version of it? I said that one is another something entirely. But I was talking about what do you recommend for cancer, and I'm asking him now, if you are on the Zoom, what type of cancer You can't just mention cancer. There are different kinds of cancer. So specify the kind of cancer you want to know about.
Is it the
Somebody
renal
was
cancer?
saying,
Is it the renal cancer that we talked about? I talked
sir?
about renal cancer just now.
Yes, but
I talked about
then you were
renal
saying, what
cancer. Is
can
it
you
that?
recommend for cancer? You didn't specify, sir. So that's what I'm saying. You should specify the kind of cancer is you want to ask about. You have talked about renal cancer already. So, and if you want to know about any other cancer, you specify. Somebody said, please, someone who had enlargement of heart operation about 2 years ago, and later was complaining of pain around the heart region. What kind of superlife product should we be taking for proper cure, please?
Okay, that one. If he had enlargement of
Heart.
there is a heart is already having problem now. So what you take a SNC and the ST30. SNC and ST30 twice. SNC swallow neuron care.
And SSC and ST30 twice.
And ST30 twice daily for the two.
The person should also contact us for proper guidance and everything, please. I think that's all.
Please feel free and ask your question. We have the doctors, the medical personnel on ground. Please feel free and ask your question, even if it is outside tonight's meeting.
Hello.
If it is a
Can you please type your question in the box? Type your question in the box.
Okay.
Type in the box so that for easy